Well, now, doctors treating the Prime Minister decided he needed a higher level of medical supervision after he suffered breathing difficulties sometime this afternoon. The decision was taken to give him oxygen and then move him into intensive care. Well, Ashish Joshi looks now at what treatment Boris Johnson will be receiving while he's in intensive care.
It was here the country's first COVID-19 patients were brought. St Thomas's Infectious Diseases Unit has world-leading expertise. Now, they must use all of that medical knowledge to treat the Prime Minister. Boris Johnson tested positive for COVID-19 last week, but his condition deteriorated quickly enough for him to need intensive care. But what exactly is an intensive care bed, and what treatment can the Prime Minister expect to receive? Eamon Sullivan is in charge of critical care nursing at the NHS Nightingale.
This is the ventilator, so this piece of equipment here will push air into the patient's lungs to keep the patient's lungs open and help them breathe if indeed they need that level of support. So really, really important piece of equipment. Suction machine, this will help the patient cough and help clear the patient's secretions and again keep the airways open for the patient as well. Okay. Other equipment that you'd see in this bed space would be a cardiac monitor and infusion pumps and feeding pumps and drip stands as well. So that would be the other equipment that you would find in this bed space. But the important piece is that this is the same kit, the same scale as any other NHS critical care bed in London or indeed in the UK. That's what we're building here.
The virus doesn't discriminate. Rich, poor, old, young, all susceptible to this potentially fatal disease.
The disease seems to follow two courses. So some people have a situation where they have this mild flu-like illness for 5 to 7 days and then they get completely better. However, other people, and there are the at-risk categories, so patients that have diabetes, chronic kidney disease, various other complex medical problems, which obviously, as far as I'm aware, the Prime Minister doesn't fall into those categories, right? But this should serve as even more of a warning shot.
The virus doesn't discriminate. Rich, poor, old, young, all susceptible to this potentially fatal disease.
We heard months ago when we first started hearing about this infection that it was really a disease of elderly people, and it was very rare in younger people. And that would include the Prime Minister. He's only, I think, 55. So he's relatively young compared to what we would expect for somebody what we would have expected for somebody to be taken ill with this infection. We now know, I think, and that's something that surprised me, that in fact a lot more younger people are taken seriously ill and in some cases lose their lives to this infection. It's probably the biggest surprise so far for me in this saga.
Boris Johnson may well be the Prime Minister, but here he's just another COVID-19 patient, and he'll be treated in exactly the same way, with the best care possible. Ashish Joshi, Sky News.
And not too very long.